Rhinoplasty is a really interesting operation because it creates huge demands on the surgeon to really understand what the patient wants. It's not an operation of one size fits all. You've got to tailor your operation to your patient's needs and requests. You've got to understand what it is about their nose that bothers them. You've got to understand also and analyze their nasal anatomy really carefully so that you can really understand what it is that is problematic and that you think you can change and make better. And you've also got to understand the profile of the nose in relation to the rest of the face. So there may be other issues around, say, chin position and things like that, or cheekbone position, that may influence the outcome of doing a rhinoplasty, and you may have to discuss that with your patient as well as to whether or not you're going to do anything about changing other parts of the face to improve facial harmony. And so there are a lot of demands around this, and it is a demanding operation, and about 10% of patients will end up coming back for some type of revisional surgery, and patients need to be aware of that. And there are different ways of doing the operation. I mean, one way is to do what's called a closed rhinoplasty, in which there are no visible scars on the outside of the nose. And the other option is to use an open rhinoplasty technique, in which you put a little scar on this part here, which is called the columella, and then you have internal scars as well. I tend to favour an open rhinoplasty approach because it allows me to see everything really clearly, to see the anatomy and to alter the anatomy in a way that is very controlled. So I prefer to use that particular approach. Preparation for rhinoplasty, very important that patients don't have any coughs or colds in advance of the surgery. It's very important that they're not taking any medication that are likely to cause any problems, particularly things like aspirin and things like that. I'm very insistent on that. I would prefer that patients ideally are not smoking, that they don't take any alcohol shortly before the procedure, and certainly ideally to avoid it maybe a week beforehand. So those kind of things are things I prefer patients to do in terms of their own personal preparation. If they have a serious infection or an upper respiratory tract infection or a chest infection at the time of surgery, we would postpone their operation until another date, until they're better. I do like to know if patients have a history of allergies, nasal allergies, or if they have a history of previous what we call epistaxis, which is recurrent nosebleeds, because that may indicate problems that we may need to address preoperatively. So all of those kind of things are important. In terms of advising the patient about the operation, obviously we go through what the operation will involve. It's individualized for every patient, so some patients will need grafting procedures done and have to explain where we take the grafts from, how they'll be placed, what they will look like the first week after surgery, and then subsequently 3 months and 6 months later and so on. The patients need to understand that they'll have a nasal splint on afterwards for a week. They will have a few little stitches to come out. I usually put a little pack in each nostril at the end of the operation. So when the patients wake up, they usually find that they can't breathe through the nose so easily, so they just need to be aware of that and not to panic. So they just be able to breathe and be very calm and breathe through their mouth. Most patients usually don't bleed very much with this operation, but they get a little bit of bleeding afterwards, either through the nose or sometimes it goes backwards, and they just to reassure them and that it's no harm. We usually advise that patients take life very easy for the first week or 10 days after surgery, and that they don't plan to go on any major holidays or get in an aircraft and fly off somewhere, or take on any sporting activities and so on, because of the risk of getting significant bleeding after surgery. They need to be aware that they'll have 2 black eyes from the operation, and they'll have a certain amount of swelling. And when the splint comes off, very often patients are very keen to see their nose and to see what it looks like. but they need to be aware that that's not going to be the final result, because there's a lot of swelling, which takes a bit of time to go down, and the structure of the nose as well, and all of the surgery that's done to the bone and the cartilage continues to change over a period of 3, 4, 5 months after the operation. So the result that patients sees on the day their splint comes off isn't really what's going to be the final result. It does take time and it will change. So patients need to be made aware of that as well. So we have a lot of discussion around that.